Hello everyone, welcome to the module on the nervous system. In this module, we will talk about a very interesting topic about nervous pathology, that is, the different types of headaches. Okay, so there are majorly three different types of headaches. The first one is the cluster headache, the second one is the migraine headache, and the third one that I'll come to is the tension headache. Okay. Now, what is basically a definition of headache? It is the pain due to irritation of structures such as dura, cranial nerves, or extracranial structures. Okay, so it is the pain which is majorly due to the irritation of the structures such as dura, cranial nerves, and extracranial structures. Now, these are more common in females except the cluster headache, or the first type of headache is only common in male, whereas the rest two are more common in females. Now, let me just come to cluster headache and talk about it. So, the cluster headache is usually unilateral and it lasts for about 15 to 3 hours, means 15 minutes to 180 minutes repetitively. Okay, now cluster headaches, they are excruciating pain in the periorbital region. That means it is usually behind one eye, and these are like suicide headaches with lacrimation and rhinorrhea. Okay, so these are basically headaches which are present behind one eye, unilateral, and these present with lacrimation and rhinorrhea. Now, these may also be presented with Horner syndrome and are more common in males. Is it clear? So, this is presented with Horner syndrome and are common in males, and the treatment of cluster headache is sumatriptan and 100% oxygen. Okay, so this is the treatment of acute cluster headache, whereas the prophylaxis for the same is verapamil. Is this clear? So we've completed this cluster headache. Coming to migraine. Okay, migraine is a unilateral headache which lasts for about 4 to 72 hours. Okay, so this is a very long duration. So it lasts for about 4 to 72 hours, and the description of this headache is like pulsating pain with nausea, photophobia or phonophobia. Okay, so the person feels nauseous, there is photophobia and phonophobia, and they may have a aura. I'll come to what is aura, but just remember that migraine headache may be presented with aura. Now, majorly, migraine is due to irritation of structures like trigeminal nerve, meninges, or blood vessels. Now, the blood vessels release vasoactive neuropeptides, example, substance P, calcitonin, gene-related peptide. Now, these present with migraine. Am I clear? Now, talking about the treatment of migraine, which includes NSAIDs, that is the non-steroidal anti-inflammatory drugs, triptans, and dihydroergotamine. Is this clear? Whereas the prophylaxis includes a variety of drugs and also lifestyle changes, example, the sleep, exercise, and diet. The different type of drugs used in prophylaxis of migraine include beta blockers, amitriptyline, formoperimate, valproate, botulinum toxin. This is a botulinum toxin and anti-CGRP. Okay, just remember the names for now. I'll come to it in a while in pharmacology videos. So just remember that it is beta blockers, amitriptyline, topiramate, valproate, botulinum toxin, and anti-CGRP. This also uses of monoclonal antibodies, but this is sometimes. Okay, so migraine is basically a unilateral pain which is more common in females. Okay. Now remember the symptoms of migraine as POUND. So it is pulsatile, 1 day duration, unilateral, nausea and disabling. Is this clear? So we have completed the two major types of headaches, that is cluster and migraine. Now coming to the third important type of headache, which is the tension headache. Now tension headache is again more common in females, but it is a bilateral headache unlike the other two. Okay, so it is a bilateral headache which lasts for around about 4 to 6 hours, that is greater than 30 minutes, and is a constant headache. Now this appears like a steady band-like pain on the forehead. So it appears like a steady band-like pain, and there is no photophobia or no phonophobia, and there is absence of aura. Is this clear? So it is a band-like pain without any photophobia or phonophobia, and there is absence of aura. Am I clear? Now talking about the treatment of tension headaches, it includes the acute treatment includes analgesics, NSAIDs and acetaminophen. Okay, so these are basically painkillers, whereas the prophylactic treatment includes TCAs, example amitriptyline, and behavioral therapy. Am I clear? So this is basically all about the three different types of headaches. Now the other causes of headaches include subarachnoid hemorrhage, which presents with the worst headache of my life. Okay, so the patient usually complains with the worst headache of his life. Headaches are also presented in meningitis, hydrocephalus, neoplasia, and giant cell temporal arteritis. Is this clear? So I'll talk about these different nervous pathologies in different modules. I've already covered giant cell temporal arteritis and vasculitis module. Now talking about the trigeminal neuralgia, which is a very important pathology. Now trigeminal neuralgia produces with repetitive unilateral shooting shock-like pain in the distribution of cranial nerve 5, that is the trigeminal nerve. Is this clear? Now, it is triggered by various activities of the face such as chewing, talking, touching certain parts of the face, and it appears for seconds to minutes, but the episodes often increase in intensity and frequency over time. Okay, so this is a very important type of pathology which is trigeminal neuralgia. Okay, now the first line therapy for trigeminal neuralgia includes carbamazepine. Am I clear? So this is all about different types of headaches and its prophylactic and acute treatment. I'll be covering a lot more pathology videos in later. So please check that out for knowing more about subarachnoid hemorrhage, that is a type of intracranial hemorrhage, meningitis, hydrocephalus and different kinds of brain tumors.
Thank you for watching this video. If you enjoyed the video, please click on the like button and do subscribe to this channel. Let me know in the comment section below which topics do you want me to explain. Thank you.